I started using drugs IV when I was 14 years old. I grew up from a family that on one side had alcoholism and on the other side had meth and everything else addiction and a lot of mental health stuff. And I experienced a lot of personal trauma, like stuff that was really traumatic to me. The people in my community just thought that that was okay and that was funny, and I was just really happy to belong for the first time in my entire life and to feel like I fit in and to feel welcome.
When my children got older, I actively used with them. I introduced them to drugs. So feeling the guilt and the shame from that, it just prompted me to use more. I know what it feels like, and that's not same as in utero, but it's the same to me as far as like using with your child is just as shameful, just as guilty. You feel like, oh my God, I'm destroying their life too. And so I can relate to them on that level. And to try to dig myself back out of that hole, it took a lot of work. It took me to want something better for my kids and to want a better chance at life.
I have also gone through getting pregnant while suffering from substance use disorder, and through trial and error, I had to figure out that I couldn't do it alone. I learned the hard way that you need support when you are dealing with that kind of situation, and you can't just stop and think that everything's going to be okay. If I had this program, I would have been so grateful.
Years of homelessness and running around and being incarcerated and not incarcerated, I found myself pregnant. I found myself homeless. I found myself in a really dysfunctional, abusive relationship. And it was hard. It was super hard. I couldn't stop.
Usually a lot of times when I share my story with the women, they always think, oh my gosh, I can't believe you don't look like that. You don't look like you would ever do that, or you don't look like you've been through that, or I never would have thought you were. But I always say, yeah, that was me.
I'm like that critical friend who helps encourage you to make the good choices in your life. And I've been through it, so I know the ropes. And so I just basically help people who are struggling with not knowing what to do next. I'm helping them just make the next right decision.
We take care of women regardless of where they're at or what they're ready for. And we help them to get their prenatal needs met and their medical needs met, as well as their recovery needs met. Like what it means to really like live life in recovery and live life in early recovery with a new baby. Like we support them through anything that they need help with throughout that entire process. And I don't think that there's any other programs that can really do that.
There are community resources out there that can help somewhat, but with nothing with the wraparound services that we offer.
We provide prenatal care for people with doctors and nurses and staff who really understand what addiction is and what it feels like and the guilt and shame that comes with being a pregnant woman and not being able to stop.
The role of the doula in Project Nurture is to build trusting relationships with our clients so that we can serve as a bridge between the providers and the various settings where our clients will find themselves as a part of their care.
A lot of the ladies say that they don't get treated like we treat them any other place, especially with health care provision. Usually they feel really judged or stigmatized, and all of those guards are kind of let down once they come here.
We have a doula, we have a midwife, we have peer recovery mentors and counselors and social workers who are a team of people who stay with you during your pregnancy, help you advocate with doctors and nurses and whatever comes up during your pregnancy. And we offer support and prenatal classes that are just there available throughout your pregnancy until your child's a year old.
If you came to me and said, I have a substance use disorder and I'm pregnant, can you help me? I would say, what kind of help do you feel like you need right now? And we would build from there.
My role as a PRM is to interact with the women and to be on an empathetic level. I can always talk to them about addiction honestly and openly and make them feel comfortable just because I can relate.
Another part of Project Nurture that I think is really cool and interesting is that it's not a very strict prescribed way of doing recovery. There's several settings within the program so that people can actually bring to their site whatever it is that they're needing. And we have doulas and midwives and family practice doctors and peer recovery mentors, drug and alcohol counselors, so that whatever services a pregnant person with a substance use disorder needs, it is available through Project Nurture.
A lot of my job is just being available. So I can pick people up. I'm often the first point of contact for women who are kind of curious or have been referred to Project Nurture. One of my favorite things that I get to do is I get to just pick people up from their house or wherever it is that they're staying, wherever that is, and we can go to coffee. We can talk about plans. We can talk about recovery goals, life goals, dreams, aspirations, grocery shopping. We can figure out together whatever it is that person really wants to figure out for their life to be improved.
Once they come to the groups, they enter into a room where it's a room full of people that have similar situations or have similar barriers to getting clean. So they see that they fit right in. Once they walk in the room, they can tell that they're in the right place.
I usually try to meet a mom where she's at. If she's saying, I'm struggling with using and I don't know if I can come to group clean, okay, that's fine. Show up. All you have to do is show up, and we'll be there to help you through the process.
I think that the coolest thing that I'm able to tell people is that if DHS shows up, we will walk you through it. Like, we will walk through that with you. We will support you through your pregnancy to try and prepare you for what possibly to come. And we will always give you worst case scenario and best case scenario and support you through that.
I used to be jealous of people who didn't use drugs. I did not know how to get clean. I didn't know that there was services and support out there. I just was jealous.
I know Project Nurture is working because it's growing. It's growing, and we have a lot of women that even once they've graduated our program, they come back for support services. That lets me know it's still working, because why would you come back to something that didn't work for you?
The transformations that I've seen is people going from complete shutdown, letting nobody in, lying about their drug use, to walking in the door and seeing other people say, yes, I have a drug problem and I'm pregnant, and them sitting down and saying, oh, I have a drug problem too, and I'm pregnant and I want to get help. That's huge.
Sometimes it's hard to see where you're at when you're in it, to have an outside point of view. Sometimes they've lost all hope, and there's still some things to be grateful for and hopeful for. If nothing else, just to tell them that they still have an opportunity to live without the use of drugs.
The biggest thing for me is that society tells us that we can't be moms because we don't care about our kids because we can't stop using. And that's just not true. We just need help. We just need a community. We just need support. We need someone to tell us that they care. That's all anybody needs.
There's help out there, and Project Nurture is a place where you're not going to be judged. People are there that know what's going on and know how to get through, that can help you, and will hold your hand if we have to through the process of getting your needs met medically and whatever else comes up because of the fact that you have an addiction. We're there for you.
Any addiction worker can say they're saving lives, any of them. And that's probably true. But the more powerful thing for me is that we're saving families. We're helping people break the cycle, really break the cycle.